Welcome back to a brand new episode of the Active Life Podcast, the #1 podcast for fitness professionals by fitness professionals. I'm Cody, joined again in studio by the Dr. Sean Pastuch. Dr.
Right.
Sean.
I heard Larry talking trash about being so happy Sean's not in studio anymore. And I was like, get me in that fucking chair. Let's go.
His favorite, you know what I was thinking about?
Yeah.
I'm glad I am the Dr. Sean's not here.
Yeah. Well, I'm here now.
Yeah, that's right. We in this. Dr. Sean, today I want to talk with you about the difference between active life and physical therapy, how someone would know if they need to go to physical therapy, what the limitations or constraints are on that, how they know and can make the decision that they should be working with active life or active life professionals. Mm-hmm. I'm excited to dive into this conversation with you.
Let's do it.
You know, I was at BNI this last week and it was my turn to do my 10 minutes. And overwhelmingly, the feedback was, you're such a great presenter. You're such a great speaker.
Nice.
And I was like, it's easy when you're passionate about what you do.
You're not giving yourself enough credit there. It is easy when you're passionate about what you do. And you have spent a copious amount of time crafting your ability to say what you mean.
Yes, that is also true. Today, Dr. Sean, I want to speak with you about one of the questions that I get the most frequently when people call Active Life. Are you physical therapy? Can I bill insurance? So I want to create a very clear understanding for the people listening to this episode, the purpose and utility of physical therapy and why we are not that.
Okay. The first thing I want to say before I even get into the conversation you're asking about is that it's understandable why people ask that question when they call. They're seeing something that we're putting out to the market that says $97 to see if we can help you get out of pain.
Yes.
Right? And they associate being in pain and getting out of it with physical therapy, chiropractic, acupuncture, the medical system.
Yes.
One of my biggest concerns about doing that, and it hasn't proven to be an issue, but one of my biggest concerns about doing that is I remember when I was practicing, people would come in when they were in pain and stop coming the second that they were out of it. And it tore me up because I knew they weren't done, right? It would be like you patch a wound until it stops bleeding, and then you never go get the stitches to close it up. You never get it checked for infection. You never take the antibiotics. Like, that's what people would do, right? As soon as they were out of pain, they would stop.
It's an incomplete solution.
A very incomplete solution. And that's why over 70% of people who get hurt and get physical therapy or chiropractic care for their injury end up needing chiropractic care or physical therapy for the same injury a second time. That's out. That's on the table now. So the reason why we are not physical therapy, why we are not chiropractic, why we are not acupuncture, or anything like that, is there is a very poorly known constraint that they have that we don't, that robbed me of my inspiration when I did it for a living, and that as a result of not having it gives me so much more inspiration now. That is that the scope of a chiropractor or physical therapist ends when a patient has the ability to perform what's called ADLs. What that means is that everything that we learn in school to be chiropractors or to be physical therapists is aimed at helping patients restore ADLs. ADL stands for activities of daily living. If a doctor of chiropractic or of physical therapy is going to accept insurance, they have to go so far as to document, well, technically they have to do this anyway for their malpractice insurance, but if they want to get paid, they have to go so far as to describe which ADL or which ADLs has been lost and demonstrate progress toward that ADL. Examples of ADLs, for people who don't know what I'm talking about, activities of daily living, are things like being able to bathe yourself, being able to sleep through the night, being able to drive a car, being able to walk 100 feet continuously. I made up the distance there. Don't quote me on it. Feel free to look it up, but it's not inspiring. Those are examples of ADLs. The ability to exercise at your chosen gym without pain, not an ADL.
Walk on the beach, not an ADL.
Throw your kids up in the air in the pool, not an ADL. any of these things. Play recreational sports, not an ADL.
Play pickleball.
Not an ADL. So when you go to a physical therapist or a chiropractor for something like that, can they treat you for it? Sure. The way that they have to write that up, if they want to get reimbursed by their visits and protected by the malpractice insurance, is going to be, if you read the notes that doctor was writing so that you could get coverage, you might find yourself perplexed by how they documented what you said was going on. I know that my patients would have back when I was doing it, because you have to make it sound like it's affecting more than just that.
Sure. Okay.
You follow me?
Yes.
And then you have to demonstrate progress, but not too much progress too fast, because then the insurance company stops paying. And not enough progress, because then they stop paying. So it becomes this game of like, they're making progress. Oop, they had a setback. Got to make progress again. Like, you're playing this absurd game to make sure that you get paid. On top of that, what people should know about insurance, and I'm not going to spend too much time on this. We can do a whole episode on insurance if you want.
Yes.
The way that insurance companies decide how doctors of chiropractic and physical therapy get paid is based on the number of visits that the average chiropractor or physical therapist, and based on the number of codes billed, so modalities used within a visit, what those numbers are compared to their peers for the same diagnosis code.
Okay.
So you might say, I have sciatica. Great. They have an endless amount of data that says the average chiropractor, physical therapist is billing 7 visits for sciatica until they're a complete resolution of their problem, and 2 modalities. Okay, fine. Let's just make that up, 2 and 7. If you're doing 8 and 3 or 8 and 2, you are under scrutiny by the insurance company, because why does it take you longer to help the patient than it takes the other person? Okay. There's a world in which this all makes sense, right? If everybody is playing an ethical game that's honest, sure. Reward the doctors who need the least amount of time to see a patient.
Well, it's also a statistical game.
Yeah, of course.
Right? You have that many people. They're like, well, we need to be able to, with some relative degree of certainty, estimate how long we think it
I
should
understand
take.
where it all comes from. Yeah. Now, if you came to see me and you had a $65 copay, and the insurance company was paying me $5 extra, $5 for the visit, you think I'm billing your insurance?
Probably not.
No,
not for that headache.
Because here's what happens. I'm taking your $65. I'm telling you that you're good to go. I'm only billing the insurance company once. And now if I see somebody else 15 times, the two of you combined are a 7.5 visit average.
Okay.
That's the game I have to constantly play as a doc. I don't want to play that game. And then every year, 2, 3, I get a phone call, or a letter really, from the insurance companies asking for notes on the following 20 people to make sure that they paid for them properly. They're never looking to pay you more.
Right.
They're looking to scrape money back. It's insane. And so I very much disliked playing that insurance game, in or out of network. It's because people will say, well, why not work for cash? Well, it's the same. It's a different problem set than the insurance game. What happens now is when you work for cash, you become a marketing and salesperson, right?
Sure.
You have to explain to people why you don't take their insurance, even though someone down the block will, even though the copay is the same. Like, it's just, it's not a fun game to play.
Yep.
So that's one of the reasons we stopped taking insurance. The other is getting someone to be able to do their ADLs. Just, there isn't something much less exciting to me in the world than that. Like, oh yeah, I can wipe my butt again. Amazing. Are you excited about that? Yeah, I'm excited about that. Okay. Have a great life.
Right.
Not so cool.
Yeah.
I also, there's a very straight line oftentimes for something like physical therapy or chiropractic. Let's say you went and got surgery on your shoulder. You got 4 anchors put in, whatever. There is a rehab protocol that you're following. There's some license for artistry within it, but generally speaking, we're following the same protocol. I like to think. I'm a vision guy. That's not fun either. Paint by numbers was Like I was the guy who was painting outside of the lines on purpose, not inside of the lines. So those things combined are the reasons why I was uninspired by that. Now, why don't we?
Yes. First off, we're not doctors of physical therapy.
Well, that's a good reason to start.
Yeah.
Right? We are aiming to solve much more pervasive problems. The problem that the medical institutions solve for, whether it's physical therapy, chiropractic, orthopedics, it doesn't matter. They are very real problems that need very real solving. And there are an ample number of people out there solving those problems. If you have lost the ability to perform an ADL, like I mentioned earlier, go see one of those people. They will provide you with a diagnosis. They will name the soft tissue or hard tissue structure that is damaged. They can order imaging to see what it actually looks like on the inside. Depending on where you're going, they can deliver shots and pharmaceutical intervention. Go. But if you're somebody who you've reached what's called maximum therapeutic benefit, meaning physical therapy isn't going to be able to help you anymore.
Okay.
You have all of your ADLs, and you're at the point where like you're trying to go hiking, but your knee acts up when you do. That's not a physical therapy thing.
So help me with this, because I will often have a conversation with somebody who does exactly, I went through physical therapy. I went out on this hike. I was out there for 4 hours. I came back. My knee was so stiff, so sore. I went to the doctor. He gave me another round of physical therapy.
Different. That's a person who's going in acutely. They're going in because they just had an injury. Mm-hmm. And now their knee is so stiff, so sore. What's it stopping them from doing?
Their ADLs.
That's the point. If you said, I'm about to go on a hike in 4 months, taking my family on vacation to Greece. I've been avoiding this vacation because I don't want to be a burden on them because I struggle to keep up. Mm-hmm. Physical therapy is not solving for that. That's not a physical therapy problem. That's an active life problem. That's a fun problem. Fun because we get to see the photos of you on the hike with your family, and we know the story behind it. I see a world where our clients are taking those photos, getting them printed, writing their story on the back, and giving them to us to frame and hang in our businesses. Like that's what I want to see.
Yeah.
The stuff that happens in the medical environment is cool for its own reasons, but it's less inspiring to me.
How do we help somebody then who's like, I mean, I don't know what I should do. I don't know if I should actually be doing physical therapy. I don't know if I should be doing training. Like, I don't know what the step that I need to take is. All I've ever known is going to physical therapy as a result of, I go to the doctor, they tell me that this is what I need. Mm-hmm.
First question is, are you inspired by physical therapy? Do you want to go back?
Well, I mean, it didn't really work that well for me the last time, or it worked for me a little bit. But no, if I had the choice, I probably wouldn't.
Okay. Then what we need to do from there as active life is be responsible and ask some very pointed questions to identify if this person's out of scope for us. Mm-hmm. Do you have radiating pain? Do you have numbness or tingling down an extremity or into your foot or your hands? Do you have weakness, legitimate weakness, not just I feel weak, but like I can't raise my arm. I can't pick my feet up off the ground. My foot drags when I walk.
Like my leg gives out.
Right. Are you on medications that could be causing all of this? These are the kinds of questions that we need to ask. Have you recently had a surgery? Mm-hmm. Did you get rehab from that surgery? If the answers to all of these questions are no, then we can bring you in for an evaluation and identify if we think that we can help. Mm-hmm. The difference between the promise that you're going to have made to you in physical therapy or chiropractic and the promise you're going to have made to you at active life is they are going to solve for the pain. That's their job. They are going to get you out of pain. That might mean restricting the lifestyle that you're able to live. It might mean you're not going to be able to play softball anymore. It might mean you're not going to be able to go on those hikes. Or you can, but keep them to the smaller ones, right? That's what they do. Mm-hmm. We want to help you when they can. Hey, it's Dr. Sean here reminding you that if you are a coach who wants to fill the gap neglected by fitness and healthcare, and you want to make a career doing it, we might be able to help you. Head to the show notes. There's a link there. You're going to click that link to download the ALP curriculum. That's the stuff that we teach to coaches over the course of 13 months to turn them into world-class professionals who never have to worry about missing a paycheck again, doing work they love to do. Go ahead and check that out, and I'll see you on the other side. Let's get you back to the show.
Is it true that, let's say you get the diagnosis, torn meniscus, or even there's arthritis in the knee, whatever, and that's where you're feeling the sensation of pain and irritation, and going through an evaluation or somebody understanding that actually the pain here is caused by a dysfunction in the ankle, in the hip, in the spine? Is it true that physical therapy treat those areas because it's outside of the diagnosis, it's outside of the box that has been painted for the client, that this is what the treatable area is?
The question you're asking me is, a patient has a diagnosis of a knee issue and the physical therapist does an evaluation, identifies it as coming from the ankle. Can they treat the ankle given that it's not the diagnosis code from an orthopedist, for example?
Yes.
Yes, as long as they can tie that diagnosis to causal of the symptoms.
Got it.
The problem is most physical therapists won't even look for that.
Oh, okay.
Now, I'm not saying there aren't physical therapists who will.
Sure.
There are physical therapists who will. Most physical therapists are not looking like that. I would urge people to think of it this way. If you go to the doctor with, I don't know, diabetes, type 2 diabetes, most doctors are going to put you on a medication for your diabetes. They might drop the cursory diet and exercise would be good for you, but generally speaking, they're putting you on medication, right? They're not prepared to, they don't have the time to, they're not educated to sit down with you and go through all of the reasons that led you to having type 2 diabetes. They treat the fact that you have it. The physical therapist is akin to that in regards to the knee problem that you're dealing with. Generally speaking, there are specific outliers. Generally speaking, when you go to the physical therapist, they are going to see you have left knee problem. We need to give palliative care, that's care that makes you feel better, to your left knee. That's what they're going to do. I'll give you an example of a very common kind of client who comes our way. I have left knee pain. I went to physical therapy, helped for a little bit, stopped going, came back, didn't really go away while I was there. Walking up the stairs, not so bad. Walking down the stairs, really problematic. Okay. What did the physical therapist evaluate? My knee. Which knee? My left knee. Okay. At Active Life, we're going to put that person through a long history. I mean, we're spending almost 2 hours with you between the discovery call and the in-person consult, right? Full history. So we understand all the things that you've done that worked and didn't work and why. And then movement assessment. And then some baseline strength, motor control, balance kind of testing. Not strenuous, just enough for us to learn. What we often identify is that the knee that is problematic is on the leg that has more strength, more motor control than the other. And so it's easy to deduce, well, maybe the reason why that knee is having a problem is because it's being depended on. It's being overused because it's more capable. I wonder what would happen if we strengthened the other side of the body. And our promise to people is that we're going to identify all of the areas where you have the necessary strength, where you don't have the necessary strength, where you have the balance, where you don't have the balance, where you have the motor control, where you don't have the motor control, where you have the education, where you don't have the education. And we're going to build up the areas where you are deficient. Our thesis, our hypothesis, is that doing that is going to resolve your problem. We are not promising to fix a torn meniscus. We are promising to cure up your deficiencies, to make you balanced, to make you whole, so that it's much more likely your body heals itself and works the way you want it to. And what we've found is that overwhelmingly that works.
Yeah, when I have conversations with people, it's, look, we can't and we wouldn't promise you that we're going to get you out of pain. What we're going to focus on is we're going to focus on restoring function and improving strength. And often, as a positive byproduct of that, the sensations of pain and irritation decrease.
Yes.
What else should somebody know if they're like, I don't know if I need physical therapy, maybe that's the right play for me, but I heard about this active life thing. It doesn't seem like a gym. It doesn't look like a gym, but it also doesn't look like a physical therapy clinic.
So I want you to imagine a continuum where you have the gym and the physical therapy clinic on one side and the other. So if you drew a line from where the gym starts or where the gym ends and where the physical therapy clinic begins, I want you to start picturing in your mind what a facility would look like. What equipment would they have as you move down that line? What equipment wouldn't they have? Let's say you're starting at the gym and you're working your way towards physical therapy. What wouldn't be in the physical therapy clinic? Certainly not in abundance. And move yourself down that line. Now ask yourself, what is the environment I would like to use the equipment that I need in? What do I want it to smell like? What do I want it to look like? Who do I want to be around me? What do I want the staff to know about me and about themselves and about the knowledge of the topic I need them to be educated on? As you move from the gym towards physical therapy, I want you to stop about 45% of the way there. That's where active life lives. We are closer to the fitness model than we are to the medical model, but we are neither. We take our inspiration from beautiful hotel lobbies. When we hired our designer to help us figure out what the space needs to look like, we did it after we interviewed over 100 people who had since quit a gym. Why did you quit? And we took into consideration everything that they described that they did not like about the gym and made sure to have the opposite of it at Active Life. I asked people why they don't like physical therapy or chiropractic clinics, and I made sure to take everything out of that. So when they walk into our space, the way I like to think about it is it's like taking a new Apple product out of the box. You don't even know why it feels so good, but it does. Well, the reason it feels so good is Apple spent millions of dollars on how it was going to feel to pull that thing out of the box. We're not Apple, but we spent hundreds of thousands. So when you're thinking about what we are, I would urge you to avoid as best you can comparing us to the gym or to the physical therapy clinic, because it's as different as asking somebody, well, how is baseball different than soccer? Well, they're both sports. They both have arenas that people come to. They both have fans. They're both on TV. They both have balls. They're both played by men and women. They both have people who officiate the game. All of these things are true. But it's easy to understand how they're categorically different. The other thing that's easy to understand is that typically baseball fans don't like soccer. And typically soccer fans don't like baseball. We are on the continuum and out of the comparison.
The last question that's coming up for me is, okay, so I understand the difference. I understand what active life is. Now I understand the difference between whether I need physical therapy or whether I should be going to a facility like Active Life. One of the things that I imagine goes through the mind of people as I'm talking to them and as they're listening to this is, I can very clearly understand the credentials and the education of a physical therapist. I know what that system, that process looks like. Now, I've also worked with a trainer and I've been to gyms and I understand, I think, the lack of education that they might have and the value that they can provide. What would be, in a reasonable amount of time, why would someone value working with an active life professional as opposed to a traditional coach? And then what's different between us and a physical therapist?
Okay. So let me go back one step and tell people who are like, I don't know which one I need. You'll know the second that you walk into physical therapy. So the way I think about this is we're not going anywhere. We're going to be here. And I'm saying this at risk of somebody trying something else instead, right? But if you're really not sure, I want you to be sure. So go there. have a visit, then come to us, have a visit. You decide which one aligns more with what you think you want to do to resolve your problem. If you feel called to be in one and not the other, do that one. Mm-hmm. I would just ask that you do physical therapy before you do us if you're going to do both.
Yeah. I've referred 4 people in the last 2 weeks to go to physical therapy.
Perfect. Why'd you refer them?
Because they were in this place where I don't know what I need to do. I've got this doctor visit. I got this visit with my orthopedist. They came in, they went through an assessment. They're like, I'm going to see, maybe it's physical therapy. I'm not really sure. I was like, hey, go do that. Mm-hmm. Go make sure that you feel you have all the confidence and you built that base, that foundation, and you've answered in all the questions that you need to answer through the medical system. Mm-hmm. Go do that. Go do your 8 weeks, your 8 sessions, whatever you need to do. Mm-hmm. We're not going anywhere.
Right.
We'll be here.
Right. And if you go there and you feel like, oh, this is definitely not where I need to be, mm-hmm. come back sooner.
Yeah.
Okay. You said within a reasonable time frame, and I get excited about this topic, so I'm trying to think of the best way to do this.
Okay.
Physical therapy school is just under 3 years. And the average physical therapist earns about $65,000 a year on average for their first 5 years out of school. A personal training education you can effectively buy out of a Cracker Jack box.
Yeah.
That doesn't mean all of them are that way.
Right.
But it starts with that, and it ranges to the highest level of personal training certification is a course called the CSCS, which is the Certified Strength and Conditioning Specialist by NSCA. That is the gold standard. If you want to work in a college or a professional strength room, you need to have that. The average amount of time it takes someone to self-study, take and pass that test, is about 6 months. That's your range. Self-study. I don't know what the CSCS costs, but I believe it's under $2,000. So you're looking at 1 day. The gold standard for the fitness industry is a 2-day seminar, all the way to the CSCS, which is the top of the top. When Active Life mentors, develops, however you want to describe it, what we call an ALP, an Active Life Professional, they're going to spend 13 months and about 1,000 hours learning from us before they even consider a specialty. What that means is we have written our own 800-page textbook that starts where the fitness education ends and ends where the physical therapy education begins. We wrote it ourselves. We have 18 hours of video content that our graduates have to watch before they're able to even take their tests. We have 996 test questions because our team is too lazy to get 4 more. We have, I believe it's 50 assignments that require someone going through our education to actually work with real people in person and apply the knowledge that they're learning, not the self-learning, mm-hmm. to real life, so that we know they're actually using this. It's not theoretical for them. They get mentorship calls one-on-one with our subject matter experts on our team. They get a call every single day in small groups with our subject matter experts to resolve the issues that they're struggling with in their business or their practical acumen. And all of what I just described happens before they can even take a specialty. And we have 4 specialties: neurologicals, longevity, working with aging populations, people over 55, return to sport, and metabolic and inflammatory diseases, so that they know what to do with someone who has MS, for example. Mm-hmm. If they do all of that, they're going to be with us for almost 2.5 years. That's the same amount of time as physical therapy school, mm-hmm. to not be a physical therapist. Now, add to that, at our facility in particular, the amount of personal development that we pour into them to reveal what's exceptional about every single one of them. We spent almost 10 hours a week for the first 6 months before we opened. or when we opened.
Yep.
And we continue to do that. We continue to improve our processes, our facility, and our people. We're fortunate. We've had people fly here to work for this mission. We've had Jess moved here from Washington State moved here from Louisiana via Washington State. Sam moved here also from Indiana via Washington State. Mm-hmm. Ken moved here from Michigan.
Indiana.
Same thing.
Everyone
in Long Beach knows it's the same thing.
Yep. Sure. Got it.
You moved here from Indiana.
Other way around.
I did that on purpose.
Gotcha. Nailed it.
And then Kate was already in Long Beach, but she was working full time as a accountant for JP Morgan Chase. Mm-hmm. We have real people with real life experience, with real passion, real education, and real intention to help the people who come to our business. This is not the job they do until they get the real job. This is the career that they work their entire lives to be able to have. Mm-hmm. Nobody else can say that about the staff they have in their business outside of the medical facilities. And if you're not looking for a medical facility, but you understand what I just said about the fitness industry is true, then you understand who I'm describing we have on site.
Mm-hmm. You want to work with a professional.
Yeah. One of the questions I love to tell my friends, or I love to answer to my friends, is when they say, hey, you're more expensive than the other gyms in town. Why is that? I'm like, I love that question. And then I ask them, who are your 3 favorite friends in town? They tell me. I'm like, okay, what do they do for a living? They tell me. They're almost always all professionals. I say, how much money do you think that they make? 100,000, 200,000, whatever it is. I say, okay. Do you think they would work for less? No. I say, great. Me either. Those are the only kind of people I want to employ. And if I want to employ those kinds of people, I have to pay them those kinds of wages. And if I want to pay them those kinds of wages, I have to charge you the kinds of price that allows me to do it. Mm-hmm. And I'm less interested in getting as many people to come here as I possibly can than I am about providing transformative experiences for every single person who comes. And they're like, that's a really good answer.
Yeah.
Thanks.
I've thought about it.
Yeah.
Dr. Sean, this was really valuable for me. Mm-hmm. I imagine the clients, the prospective clients, anyone listening to this, I imagine this is helpful for them to start thinking about how they're making decisions, mm-hmm. or how they're thinking about making a decision.
There's a story that I heard that I'll kind of close this out because it seems like we're done here. That I always thought it would be really cool if I could have stories like that to tell. And it was the owner of a company called First Form talking about when he first realized customer service is what was going to sell his product over his product. Hmm. And a woman called one day and their customer service answered the phone. And they said, what questions, how can we help you? She dialed the wrong number. And this is before, I guess, like navigation was ubiquitous. And she was like, I don't know, like I'm lost and I'm trying to get to this place. Without missing a beat, they asked, where are you? And where are you trying to go? What was that address? And they looked up the directions. And they gave her the directions over the phone so that she could get where she was trying to go. They didn't say, oh, sorry, you have the wrong number. They didn't say, we don't help people navigate from where they are to where they want to go. They just help that person solve the problem. Mm-hmm. I know we do the same thing. It serves as a metaphor now because people aren't calling for directions. But I know that when somebody calls and talks to you or talks to Ken or talks to Kate or talks to Sam or talks to Jess, they're going to get the best help that's possible for them, agnostic to who gets paid for it. Mm-hmm. We're going to refer them out if they need to be referred out. And whenever possible, we're going to make a white glove introduction to the person who they can talk to directly. I'm proud of that. And I want people to know it.
I've had 2 of those this week.
I'm not surprised.
One I connected directly with a professional PT here in town, mm-hmm. and one I connected with a trainer who would go to his house.
Mm-hmm. Perfect.
Dr. Sean, thank you so much for your time. Excellent catching up with you, having you walk me through and everyone else through the difference between physical therapy and active life. Remember, if you enjoyed this episode, 5 stars, share it, tell a friend. We appreciate you. See you guys out there.